This video will present the highlights of the thyroid and parathyroid, a young parathyroid and an older one. So first of all, the thyroid and the young parathyroid. Parathyroids are always embedded very close to the thyroid, actually often within the same capsule. If you zoom in on this, you will see there's a capsule here, and it's enclosing both the thyroid and the parathyroid. Now this parathyroid is extremely young. All you see are the chief cells, and they're actually arranged in cords between blood vessels. A little hard to see the blood vessels, but all the pink you see here are red blood cells that have kind of congealed where you can't see the individual cells. And then they're very tiny vessels, capillaries between these. So, and then over in the thyroid gland, this is a fairly normal looking, you might call it a euthyroid, EU. That's a normal level of thyroid hormone that it's being produced. The follicular cells are almost all of them are cuboidal, and there's some of these vacuoles here, which indicates that the follicular cells are ingesting some of the thyroid globulin and then knocking off the globulin and secreting the thyroid hormone into the capillaries on the side. This is again the lowest magnification, but what you want to be looking for is not only the follicular cells, but also you see this cell right here. So I'm going to artificially enlarge it a little bit more, and you can see that its cytoplasm is very clear or non-stained, or at least it's very lightly stained. And that is what a clear cell looks like. Here's another one here, and those are C cells, and those are the ones that are producing the hormone calcitonin that you are learning about in lecture. Once again, over the parathyroid gland, you see no adipose tissue, and I really can't spot any oxybutyl cells at all. And it's thought that the oxybutyl cells are, we don't know their function, but we think that they're worn out chief cells that have been producing parathyroid hormone. So let's go from this one to the older parathyroid. And actually the thyroid gland, as you're learning in lecture, it could be active columnar cells or very inactive flat cells, but be very unusual for the thyroid gland to be infiltrated with adipose tissue. However, this parathyroid is very heavily infiltrated with adipose tissue, and the bluish cells that you can see very little cytoplasm but see their nuclei are the chief cells. But then here are very red eosinophilic cells with very hyper stained nuclei. That is very heterochromatic nuclei are the oxybutyl cells. That's a bunch right there, and let's see, there are not very many. If we look around, I see a few right in here, maybe in here, but the most obvious bunch is that one that I just found. Let me find them again. Well, there's a small patch of them right here. So chief cells, oxybutyl cells, adipose tissue, a thyroid or a parathyroid gland from an older individual.